Let's begin with the second section of our lecture, and in this section we will talk about the operation or procedure known as Caldwell-Luc Operation. We will discuss the indications of Caldwell-Luc operation and also what's the technique of this operation, postoperative care and complications of Caldwell-Luc operation, and also the present status of this procedure. Caldwell-Luc operation, it's also known as anterior antrostomy. In the first section, we talked about the procedure, which is inferior meatal antrostomy or inferior antrostomy. Compared to that, this is known as anterior antrostomy. So the opening in this is created anteriorly here. If you see, that's the place from where the opening is created. So it's the process of opening the maxillary antrum through canine fossa by sublabial approach. So sublabial approach below the lip, sublabial, under the sublabial approach, and dealing with the pathology inside the antrum. So any pathology, any abnormality, any pus suppuration or any other thing that needs to be dealt with in the maxillary sinus, in the end, the approach to that is through the anterior opening in, and this is known as anterior antrostomy below the lip. It's sublabial approach. Access to maxillary sinus is through anterior wall of the sinus. So here, that's the maxillary sinus very close to the nose. So the approach to this maxillary sinus below the sublabial route, below the lip, is the anterior approach to the antrum of the sinus. Indications, what are the indications or conditions in which we can do the anterior antrostomy? We have chronic maxillary sinusitis with irreversible changes in the sinus mucosa. This indication is the same as the inferior antrostomy that we can perform for the maxillary sinusitis, purulent chronic maxillary sinusitis with irreversible changes. In that is the contraindication if there is irreversible changes in the mucosa, but anterior antrostomy can be performed in this condition. So chronic maxillary with irreversible changes in the sinus mucosa is one indication. Removal of foreign body or root of a tooth. Dental cyst can be removed through this opening. Oroantral fistula, if there is opening or fistula between the oral cavity and the antrum of the maxillary sinus, that can be fixed by this anterior antrostomy. Suspected neoplasm in the antrum and its biopsy. So now you know that in conditions which are the contraindication for inferior antrostomy, these are the indications in case of anterior antrostomy. So if there are changes in the sinus mucosa, if there is suspected malignancy present, we can perform anterior antrostomy. Recurrent antrochoanal polyp, fracture of maxilla or blowout fracture of the orbit. As an approach to ethmoid, Horgan's transantral ethmoidectomy. Approach to pterygopalatine fossa for ligation of maxillary artery. So all these are different indications, and also for VD and neurectomy. So a lot of indications for anterior antrostomy, chronic sinusitis with irreversible changes in sinus mucosa, suspected malignancy, oroantral fistula, dental cysts, and the fracture of the maxilla or the orbit of the eye, Vidian neurectomy. So all these are the indications of the anterior antrostomy, which is through the sublabial route. Now the Caldwell-Luc anterior antrostomy operation. This is the patient, this is the supine position. Supine position is the position in which the patient is on the back with the lying straight on the back with the face upward. Prone is the position with the patient on the stomach with the face down. So that's the difference between the two positions. Contraindication of this operation: patient below 17 years of age is contraindication. So this procedure, anterior antrostomy, should not be performed in patients who are below 17 years of age. Anesthesia which can be used: general anesthesia with the cuffed endotracheal tube and pharyngeal pack can be done under local anesthesia. So both type of anesthesia, general and local, can be used for this procedure known as anterior antrostomy, in which the anterior hole is made in the antrum of the maxillary sinus in the subbuccal route. Position is reclining with head end of the table raised. So the head end of the table is raised. Patient lies supine with face slightly to the opposite side. So that's the position of the patient, reclining. Patient is supine with face turning to the opposite side. Technique which is used for the Caldwell-Luc operation or anterior antrostomy: horizontal incision with its ends upwards below gingivolabial sulcus from lateral incisor to second molar. So an incision is made, which is the horizontal incision from lateral incisor to second molar tooth. Mucoperiosteal flap raised from canine fossa to infraorbital nerve. Using cutting burr or gouge and hammer, a hole is made in the antrum. Opening is enlarged using Kerrison's punch. Pathology is removed, making nasoantral window. Packing the antrum is done. Closure of the wound is done. So all that is the technique. Opening is made, becomes widened, and any pathology which is present, any abscess, suppuration present that needs to be sucked out, and if there is any foreign body that needs to be sucked out. Contraindication is patient which is below 17 years of age, we should not use the procedure. Post-operative care: ice packs over the cheek. This is the area that is used. So ice packs over the cheeks are applied in the first 24 hours. Packing in sinus and nose is also removed in 24 to 48 hours. Antibiotics are used for 5 to 7 days. Avoid blowing nose for 2 weeks. So all these are the post-operative care measurements that should be performed to avoid any complications. So blowing of the nose is avoided. Maxillary sinus irrigated through antrostomy with the saline. and patient can do it himself with Higginson's syringe. So antrostomy and opening is present, any pathology is removed, packs are removed, nose blowing should be avoided, and any suction that needs to be performed, cleaning of the opening maxillary sinus is irrigated using the saline. Patient even can perform this procedure on its own. Complications of the procedure: post-operative bleeding as with inferior antrostomy, anesthesia of the cheek. Usually there is numbness of the cheek because of the procedure that is performed. So there is anesthesia of the cheek. Anesthesia of teeth. Injury to nasolacrimal duct, which is the duct through which the tears come out. So injury to that duct can also occur as a result of the complications. Sublabial fistula, because the opening is created through sublabial approach, sublabial below the lip, a fistula can be formed, a permanent opening between the antrum and the oral cavity can be performed between the sinus and the oral cavity that needs to be repaired. So formation of the fistula is also a complication. Osteomyelitis of maxilla can occur, but this is a rare complication. Present status is a Caldwell-Luc operation indicated in limited situations now. Initial step in medial maxillectomy, if performed, Caldwell-Luc operation is done. Management of complex midfacial fractures to repair orbital floor fractures, removal of foreign bodies, management and staging of carcinoma of palate. All these are the indications in present status. All these are the conditions in which we should use the Caldwell-Luc operation. So that was all about this section. Thank you for watching sqadia.com.